Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back, everybody. Welcome back. You're listening to Living Pain Free. I'm Dr. Thomas Grove, sports medicine physician, fellowship trained. My specialty is we do regenerative medicine. Okay, what we do is we take the body's healing cells, concentrate them down. You use things like platelets and stem cells to help accelerate the healing, rejuvenate an area, and try to avoid an unnecessary elective orthopedic surgery. So we're talking all things sports medicine, musculoskeletal medicine. To get an ache or pain, you're curious about it, you want to think about maybe a more conservative way to address your pain, not get hooked on the pain pills, not go to the operating room. Check out regenerative medicine. It's a very, very exciting time where this sort of treatment is getting more and more well known. A lot of your favorite athletes and celebrities are getting more vocal because we've been doing this for years about their experience with this sort of treatment. Very, very minimal in terms of side effects, a little stiffness, a little soreness. We're not dealing with the same sort of side effect profile of a surgery, so very safe sort of treatment to receive. A lot of times we can save folks from surgery, so it's a fantastic, very, very fun, very, very satisfying sort of job that we have. So I want to give you guys a chance to talk to me live here in the studio. If you got a question or concern, give us a call and we'll talk about it. I'm at 866-870-5752. That's 866-870-5752. Give us a call and we're going to give you a copy of our book for free, even pay the postage for you on that. Title of that book is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. If you're ready for a free consultation over the phone with our staff, that number to call is 800-300-9300. That's 800-300-9300. If you want to check out our website, spot on every page for you guys to get in touch with us, send us an email. While you're there, check out some videos of us doing the procedures, check out some educational content, recordings of our radio program. We're at www.stemcellinstitute.com. That's stemcellinstitute.com. So a lot of really fun topics to talk about here today. I had a case that is just really in the back of my head all week here. Very, very common topic. Like we talked about earlier, when you get a radiology report, a lot of times you're just going to find some things that are not normal, especially as we get older. So you might find, a meniscus tear in the knee. You might find some arthritis in your back, degenerative discs, for example. I had a patient this week that was told that she had a labrum tear in the hip. The labrum is kind of like a little suction cup to keep the ball up into the cup. We've got a labrum in the shoulder, labrum in the hip. This person had an issue with what they thought was their hip. I'm already kind of hinting at what the outcome there was. So again, a lot of times this is what the trajectory is. You have pain, you get your image, they find something that's not normal, and they go, oh, that must be the cause of your symptoms. Now, the big issue with that is, if we're looking at, if you're the radiologist, I spent a lot of times in rotations with musculoskeletal radiology, right? You're in the dark room, nice and quiet, controlled environment, but you're not really looking at the patient, right? All you're seeing is the imaging, right? And it's your job as the radiologist to call out anything that's not completely normal, right? So if you've got maybe a shadow, an artifact, something looks a little strange on one slice of that MRI, you're going to call it out, right? Now, that might not be accurate, right? That could just be a little bit of an error called an overread, right, of that imaging report, which can lead to a lot of unnecessary surgeries because they're diagnosing the problem, right? So again, the pathology is what you see on the imaging report, which is, that's one thing. And then you got the reality. What is the patient experiencing? Where is your symptom, actually coming from? So this is an example where actually on the radiology report, it said an indeterminate tear of the labrum, meaning we don't quite know if it was there. There could be a little something there, so we're just going to call it out. And again, the patient sees that read and says, oh my gosh, there's a labrum tear, immediately gets a consultation with a surgeon, and they're like, oh yeah, we can go in and take care of that. Again, the big idea here though is if the labrum, is not causing the symptom, to go in and do a surgery, right? The way they describe it is like, yeah, we'll just go in quick and take a look with a scope and go clean it out. The problem with that, guys, is again, the anesthesia from surgery, right? We don't want to expose ourselves to that if we don't have to. Anytime that we, cut the skin, infection risk, right? And then anytime we go into a joint space with one of those scopes, okay, called an arthroscope, you're actually piercing the covering of the joint called the capsule. Now, the capsule provides a ton of stability to that joint, so we go and cut it. Now that joint immediately becomes less stable, And then if you're going out and trimming out, tissue within a joint space, maybe some cartilage, maybe, a labrum, right? Maybe if it's in the knee, maybe a meniscus, for example. Now you're instantly giving that patient more arthritis. Okay. So again, for me to send a patient to surgery, I got to have a really, really good reason. Okay. So let's just talk labrum tears for a moment. If you got, labrum tear in the hip, typically what you're going to have with that is what we call mechanical symptoms, meaning that hip's going to kind of lock up. It's going to feel super crunchy. It might get stuck where you kind of have to unstuck it, right? Get that thing straightened back out again. That's a very classic sort of presentation for a labrum tear, which typically comes with, less range of motion, a lot of pain as you move that hip around. So immediately when this patient came in, I was really excited. I'm like, let's get to the physical exam, and full range of motion. Okay. No pain there. As I'm putting that ball into the cup and rotating it around, right, I'm kind of painting that entire cup to see if there's anything that's, catching or clicking or clunking. None of that was happening. So no mechanical symptoms. So immediately I'm like, this is probably not a labrum tear causing what her symptoms were. And again, then we get into the palpatory part of the physical exam where I'm actually pressing on the tissue around that hip. Remember, again, there's a lot of anatomy around a hip joint. Okay. A lot of muscles, tendons, ligaments, a lot of things around that. That if you have a little strain or a little tear or something, can cause a lot of pain. And then in your head, you're thinking, it must be my hip joint because it's around my hip joint. And in this case, it was not, right? It's a little muscle called the iliacus. Okay. Again, you guys can check this one out. I always encourage you to, if you're listening to the radio program, Google this stuff, get a good visual representation. The iliacus is ILIACUS. It's a muscle that helps, with some hip flexion, one of your hip flexor muscles. It comes right by the hip joint, but it's not the hip joint. So her pain is actually a little bit above the joint. Very, very classic. This is a person who's very, very active, actually trained a lot of folks. So does a lot of working out. Just had a tough workout, did a little overuse, and pain, popped up, got an image, and they thought, maybe there's a labrum tear. And I threw the ultrasound on. I didn't really appreciate much of a labrum tear on my exam. But more importantly, not physical exam, pain's not coming from the hips. This is somebody who was geared up, ready for surgery. And I actually heard about us from the radio. I said, let's get a second opinion. I'm not really, hot on just going underneath the knife just because. So this is somebody that, again, I can, guarantee that's not where that pain's coming from. Very, very classic presentation. Very, very, common in the athletic population as well. Just a little strain of a muscle, right? Not a big deal. We go in, put some cells in it, accelerate that healing, and keep that person out of the operating room. Remember, you got to line up that picture, right? What are the clinical symptoms? What's the history? What is the patient truly, experiencing? And then we combine that with the imaging report. And then again, I don't trust the reports. I like to scan you myself. I can do it right there in the clinic. We can look at the screen together. I'm not sending you away and you can't see the image. And then, if someone's translating the imaging report, which can be a foreign language sometimes. So we do it all in the clinic, right? That's why I got all that extra training in musculoskeletal ultrasound to not only help diagnose what's going on, but then, when we're doing the treatment, we can really, really be pinpoint. I can put that tiny needle, within about 0.5 millimeter of any anatomic structure. So I can put those healing cells directly to where that pain's coming from and put you in the best position to heal. So this is a really, really common case that we get where, again, you come in one diagnosis and then you leave with another, right? So it's very, very important that if you're considering a surgery, that we're really making sure there's a good reason for it, right? And again, there's certainly, very good indications for surgery. I am not saying all surgery is bad. I did, probably 10,000 hours of orthopedic surgery during my training as well. It's a fun environment. I loved it. It's power tools. It's broken bones. You're in the trauma bay. I was in a lot of level 1 trauma centers all over the country. So it's a very sort of, high acuity, exciting sort of environment to be in. But we're looking at elective surgeries. Just a lot of these things just aren't needed. I just saw it time and time again where, folks weren't getting better. And then when you start to compare that with the outcomes with regenerative medicine, which is minimally invasive, little pokes, right, with little needles, this is going to be a much, much better option for somebody to avoid a major complication, right? And if you're looking at things like, labrum surgeries where you're trimming things out, giving yourself more arthritis, now you're going to accelerate the degeneration of that joint, right? And now that might, lead to a sooner position where you can't, use that body part anymore, especially for a weight-bearing joint like a hip. Man, when that thing starts to go, now those daily walks, you're squatting, you're lunging, you're hiking, those become more and more difficult, which we talked about earlier with one of our callers, how important it is to stay fit, stay physically active as we age to optimize our health, right? So very, very important that we do that. So we got a couple more minutes here, guys, left in the second half of the segment. We've got a caller coming in to us here from Whittier. We've got Ruben. Ruben, how are you?
Hey, good morning, man. How are you?
I'm doing well. How can I help you, sir?
All right, pretty good, man. Hey, first of all, I just want to thank your staff, man. I was on hold with Steven, man. Cool dude, man. So appreciate
awesome.
that, bro. Awesome. Hey, you know what? So I'm a past patient, man. I've had multiple PRP injections with Dr. Darrow, and thank God for that, because my lower back is actually stable now, so which is good. So that's why I'm calling back. I've been having some neck pain, and thank God I did get an X-ray, and they said everything was normal. So like I was totally happy about that. I thought everything would be jacked up like my lower back. So, anyways, I'm thinking about maybe the PRP could help me again. But I had a question for you, man.
Of course.
So I noticed a couple celebrities, man, are going like to Mexico to get this. I know you guys offer stem cells. I know a couple celebrities. I ain't gonna drop no names, but they said they went to get Muse stem cells to go out of the country. Now I wanted to ask you.
Yeah.
Is that stuff that, so obviously going out of the country because we don't have Muse stem cells here? Or, is that something that we're going to get here in this country, or is it just like, what's the difference between Muse stem cells and, you don't got to go detail what the difference is, but I'm saying, what is it?
Yeah, absolutely. This is actually a very, very common question. So, like I talked about earlier, a lot of folks are getting more vocal about, their experience with stem cells and platelets and regenerative medicine. So, you're getting a lot of, social media coverage and a lot more, exposure for what this sort of, field is. And, we're all trying to figure out, what is the best sort of cocktail of, cells and growth factors that we can put into a syringe and inject to get the best results. So, it's a very, very exciting time. There is a ton of research going on, not just in the United States, but all over the world. Because we're getting such good results with PRP and stem cells, so there's a lot of interest in trying to figure out, okay, what's the best? How do we improve this sort of treatment in folks? And so Muse are it's a type of stem cell. Remember, stem cells are these cells that help regenerate tissue. It helps grow and repair damaged things like tendons and ligaments and joints, things like that. Muse is MUSE, which stands for multi-lineage differentiating stress enduring cells. So basically, it's another type of stem cell that's actually in the cocktail of stem cells that we use. Whether you're doing like bone marrow or fat, there's all kinds of ways you can get these cells. But the idea is, you're putting these stem cells in a stressful environment, the ones that survive. That's what they're calling Muse cells. A lot of controversy in the space in terms of what is that type of cell? How do you guarantee that? The issue is a lot of these treatments are super, super expensive. So again, for me, it's got to be cost effective for the patient, right? There's a lot of different variations of, platelets and stem cells that are out there. But again, we're in a position where there's a lot of research that's being done. And once we get a really good, study that comes out saying, hey, this specific, type of cell is, let's just say you're charging 10 times the price. If it's 10 times as effective, yeah, man, I'll definitely take a look at it, maybe implement it in my practice. But for me to charge somebody, 30, 40, 50 plus $1,000 for a single treatment, it's got to be marketably better than what we have access to here. So, again, it's a very cool area right now. We're doing a lot of research where we're just trying to put names to these sorts of treatments where you can market it and say, hey, this is better than what we had before. So very interesting area. But yeah, Muse cells are actually in the stem cell cocktails you can get here in the United States. So the idea is you're just kind of isolating a certain cell type within that cocktail of cells. But again, jury's not quite out yet for me in terms of the research. Not great, level 1 randomized controlled trials in humans yet to rationalize this very, very high price tag. Does that make sense?
Oh, okay. Yeah, yep. but so since they go out of the country, but you're saying, but they're offered here too. So celebrity has to worry about price, right?
Yeah, they're all over the place. Yeah, it's just for me.
Again, are they really?
Yeah, okay. I gotta be cost effective with patients. That's the big deal.
Yeah.
Because they're super expensive. Yeah. But again, eventually, as if we get good research studies out there, I'm sure it's going to be more and more affordable. But already, stem cells are multiple thousands of dollars here in the United States. You're going to find guys that are charging a lot of money, right? So we got to make sure we're being cost effective and sensitive to patients for that.
When I got my PRP, man, you guys weren't that bad actually on the.
Yeah, we're very, very competitive.
I don't know if the terrorists brought it up though. You know what I mean?
Yeah. So the issue with regenerative is
an extra $300 now. Oh, you.
Yeah, man. Yeah. So the issue is because insurance doesn't cover it. It's cash based, so people can just name their price. Again, as you shop around, you find out what we charge. We're hyper competitive because again, we want to make sure this is accessible to folks. We don't want to.
I've been there. I've been there 4 times, man, and I'm just like I said, man, I'm a UPS driver, so my money's important to me. So
yeah, absolutely.
I've been there four times, and I appreciate it, man. So I was thinking about doing the stem cell, but actually, I think the fourth PRP, man, it kind of stabled me out, man. So, but now I want to do my neck, so I'll probably just go in there and do the PRP. But I definitely wanted to ask you about those stem cells, man. But I appreciate taking my call, man. You sound like a good cat, man. I
appreciate you, man. Yeah, excited to see you again. Get you in the clinic again. I treat necks. I mean, almost every single day of the clinic. It's one of those really common causes of pain. Yeah, I'd love to get you in.
All right, thank you.
Appreciate you, Ruben. Thanks, sir.
Bye-bye.
Yeah, really good talking points there, guys. So yeah, when we're looking at, the landscape of regenerative medicine right now, there is a ton of research coming out, and I'm always in the hunt. What's the latest and greatest? But I also have to balance that with what is cost effective for patients, right? Because I can find cocktails that cost, $50,000, $100,000. But again, for me, ethically, I got a problem with that, right? We got to make sure we're being cost effective for our patients, because it's fun, right? If I can keep costs down for somebody, maybe they can afford another treatment, or maybe on a different body part that was bugging them, right? Or like we talked about earlier in terms of, what's the, important aspect of someone getting pain relief. Sometimes it does take a couple of rounds of treatment. Like Ruben said, PRP, typically, it's a couple of goes at it, but we have a subjective decrease in your pain. And so if I can put more people in a position to be successful, man, this is what I feel good about. Gets me out of bed in the morning. I love doing this kind of work, because again, you really get to help folks. Ruben just mentioned as well, great talking point here. To contrast earlier, we're looking at, an imaging report and said, hey, you actually have some pathology, but many times as well, you're going to have an imaging report that says, no, it's totally fine. It's normal. It's insignificant. It's unremarkable, which to me is a very triggering sort of phrase, right? Because you as the patient, you're like, man, I got some pain. That is not insignificant. That's very significant in my life. And so you see the radiology report, and then, your doctor says, oh, well, there's nothing wrong with you. What do you think that makes the patient feel like, right? If you've got some pain, you got some symptoms going on, and you're telling the patient there's nothing wrong with you, I got a problem with that, right? So many times we see a lot of, for example, the neck, a lot of ligament strains that very rarely are ever called out on an imaging report, because it's not torn, right? Tears are pretty easy to see, but those ligaments around the entire spine are really, really, really strong. So they're really hard to tear outside of like falling off of a roof, major car accident, something like that. So a lot of times people are going to have these sort of issues, but their imaging report won't line up with that story, right? So that's where physical exam is super, super important. These little ligaments that connect the backbones to themselves, or the bones in the spine to the base of the head, right? All these little ligaments that are there. There's a ton of anatomic structures that can cause pain in folks, especially in the neck. You have a whiplash injury, maybe you got headaches, you have all kinds of maybe instability of those sort of structures can cause a whole slew of sort of symptoms in folks. And that can be very frustrating as the patient, where image report's not telling you anything and that's saying, hey, this is for sure what's going on, and you're suffering with the symptoms. And then what do? It's like, well, let's just start throwing medications at this person, see what decreases their symptoms. When we're getting away from the basics, right? We got to do a good hands-on physical exam. We got to figure out where are those symptoms coming from, number one. And then if we can address it with, injection therapies, even better, right? We, bring you in the clinic, get your injections done, take a little rest period. And again, sometimes you need a couple of goes at it, but many times we can get folks back in shape. I still think today in the United States, leading cause of disability is, back pain. So it's such a common issue. Definitely top three things that I treat in my clinic. Very, very common. Again, it's one of the fun areas for me to inject, because I can use that ultrasound and really be specific where I want to put that needle, because it's a pretty dangerous area to inject blindly. There's a lot of stuff in that area, spinal cord, right? Major vessels. You got to make sure you're being careful about that. So if you're considering a treatment like that in a spine, make sure this is somebody who has training in it. Make sure this is somebody who's got experience seeing those sorts of issues, just for your own safety. Because when implemented properly, regenerative medicine is incredibly, incredibly safe. It can be very, very effective. And we're looking at, the alternative. Let's just say there was maybe something wrong on his imaging report, like a disc bulge, for example. You take it to the wrong person, they're going to want to put you into surgery, right? And we're looking at things like elective surgery in the spine. It's a much higher sort of complication rate area. It's a tricky area, right? If you, put a screw through a bone and then you hit the spinal cord, you hit a major vessel, that can be completely catastrophic. We're talking major bleeds, strokes, heart attack, blood clots. You put it into a nerve or the spinal cord, you're talking about being paralyzed, right? These are major, major side effects that we want to try to, avoid, right? My goal for folks is I want to limit your exposure to those sort of side effects. Be safe, be conservative when we can, Because when we do that and we can get you back in the game for the injections, man, even better. It's a really, really nice way that we can treat the human body without having to, subject you to those sort of side effects. So got a couple more minutes here, guys, left. Second half of the program. You're listening to Living Pain-Free, educational program. Today we're talking all things musculoskeletal medicine, sports medicine. Maybe you got an ache or a pain, and you're interested in a more conservative way to address that. Think about regenerative medicine, PRP, and stem cells. If you got an issue, let's chat about it. You can talk to me live here in the studio. That number to call is 866-870-5752. That's 866-870-5752. Great gift for you guys as well. If you give us a call, we're going to send you a copy of our book, is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Even pay the postage for you on that. And if you're ready for a free consultation over the phone with our staff, give us a call. That number is 800-300-9300. That's 800-300-9300. Check out our website. It's about every page for you guys to get in touch with us via email. We're at www.stemcellinstitute.com. That's stemcellinstitute.com. Another really fun case I had here this week. I was actually treating this gentleman for one body area, and I saw him. He kept holding his hand. He kept pulling on his finger. And I'm like, hey, what's going on with that? And he's like, oh, man, you're not going to believe this. So I jammed my finger. I believe it was like a basketball injury. So jammed his finger, actually dislocated one of his finger joints called the PIP joint, or the proximal interphalangeal joint. So not the knuckle that, you punch a punching bag with, but the one that's just towards the tip of the finger there. So he dislocated it, and then he actually just popped it back in himself. And then he showed it to me, and he's got this really big swollen joint. And he's like, man, there's nothing you can do for this, right? And I'm like, whoa, hold on now. So this is actually a very, very common injury, especially in the sports world. I remember I was a team physician for many years. Most recently, I was at Virginia Tech. Very, very common, right? Basketball, football, right? Finger gets popped out, right? We pop it back in, take an image, make sure it's not broken. Man, get you back in the game, right? But what can happen when you dislocate any joint, whether it's the patella and the kneecap, right? Maybe it's the shoulder, right? Maybe it's a finger, right? When you do that, even if you get it relocated back into the good position that it's supposed to be in, or even if it's a partial dislocation, which is called a subluxation, what we do is we actually stretch out some of those supportive structures around that joint. So even if you get the joint back in position, a lot of times we did some damage to those neighboring structures, and that can lead to a lot of chronic pain. And in the finger, it's pretty obvious because you get swelling, right? And if you're not used to having, swelling in your fingers, he had like this giant, it was like a golf ball size where his knuckle was. This is somebody that, fortunately with one treatment, took down a ton of that swelling, got his range of motion back. So when I do an injection series around any sort of joint that's been dislocated, I like to put a little bit of cells into the joint itself, but really the main area we're trying to go after is those supportive structures, right? The ligaments, which attach bone to bone, the tendons, right, which attaches muscle to bone, and then the joint capsule, right? All those things provide a lot of stability to that joint, so hopefully that thing doesn't re-dislocate again, right? So that's the end of our program here, guys. Thank you so much for tuning in. We give out that phone number, give you guys a chance to get a free consultation over the phone with our staff. We're at 800-300-9300. That's 800-300-9300. And check out our website. It's on every page. Get in touch with us, www.stemcellinstitute.com. We'll see you next week.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.